Outcome measures are collected once at admission and are not repeated. True or false? True, false, false. Outcome measures are calculated from the data gathered during inter-RAI LTCF assessments. Since these assessments are conducted not just at admission, first assessment, but also regularly during routine reassessments, typically quarterly, and whenever there is a significant change in status, the outcome measures are repeatedly updated and reviewed over time to track the resident's progress and support ongoing care planning. The CHESS scale has a maximum of 10. True, false. The correct answer is false. According to the inter-RAI LTCF training materials, the CHESS, Changes in Health, End-Stage Disease, Signs, and Symptoms, scale has a score range of 0 to 5, meaning the maximum possible score is 5. The Depression Rating Scale, DRS, maximum score is A8, B12, C14, D20. The correct answer is C14. According to the inter-RAI LTCF training materials, the Depression Rating Scale, DRS, has a score range from 0 to 14. The scale is calculated using 7 specific mood and behavior items such as making negative statements, persistent anger, repetitive health complaints, and crying. Each of these 7 items is scored between 0 and 2, and when added together, the maximum possible total score is 14. A CHESS score of 5 indicates A. No health instability, B. Maximum health instability, C. Moderate decline only, D. Risk of depression. The correct answer is B. Maximum health instability. According to the inter-RAI LTCF training materials, the CHESS, Changes in Health, End-Stage Disease, Signs, and Symptoms, scale is designed to detect frailty and health instability. The scale has a score range from 0 to 5, with higher scores indicating higher levels of medical complexity, health instability, and a greater risk of serious decline and adverse outcomes, such as mortality or hospitalization. Therefore, achieving the maximum score of 5 indicates the highest level of health instability. Which of the following best describes the relationship between outcome scales and CAPs? A. They are calculated independently and not related. B. Outcome scales override CAPs in care planning. C. Outcome scales inform CAP triggers and provide context. D. They are used only for statistical analysis. The correct answer is C. Outcome scales inform CAP triggers and provide context. Based on the inter-RAI LTCF training materials, many collaborative action plans, CAPs, feature multiple trigger levels and explicitly use derived outcome scales within their algorithms to determine these triggers. For example, outcome scales are used as prerequisite calculations to inform the trigger logic for various CAPs. The Cognitive Performance Scale, CPS, is used to trigger the cognitive loss CAP and the social relationship CAP. The Depression Rating Scale, DRS, is used to determine the risk levels for triggering the mood CAP. The ADL hierarchy scale informs the trigger status for the activities of daily living CAP and the physical restraints CAP. Therefore, outcome scales are not independent or merely statistical, they directly feed into the CAP algorithms to help identify a resident's risk levels and guide the interdisciplinary team in care planning. What are the specific scoring criteria for the CHESS scale? Explain the difference between early, middle, and late loss ADLS. Search the web for clinical case studies using inter-RAI CHESS. Which of the following CAPs addresses issues related to reduced physical activity? A. Delirium CAP. B. Physical activities promotion CAP. C. Feeding tube CAP. D. Cognitive loss CAP. The correct answer is B. Physical activities promotion CAP. The Physical Activities Promotion CAP specifically identifies individuals who engage in low levels of physical activity, which is defined as less than 2 hours over a 3-day period. This CAP is designed to address the increased risks associated with reduced activity, such as functional decline, falls, and cardiovascular issues, and it outlines goals to increase physical activity levels to maintain and improve the person's mobility. What best defines a triggered CAP? A. An error in assessment. B. A prompt to complete another section. C. Signals the need for clinical review and, if warranted, a tailored care plan. D. An optional CAP suggestion. The correct answer is C. Signals the need for clinical review and, if warranted, a tailored care plan. Based on the Inter-RAI LTCF training materials, collaborative action plans, CAPs, are automatically triggered when certain patterns in assessment items are detected, identifying specific problem areas where a resident may benefit from care and support. A triggered CAP flags these areas for the interdisciplinary team to conduct further clinical assessment and collaborative care planning. The guidelines emphasize that while CAPs highlight potential risks or areas for improvement, they do not automatically prescribe interventions. Instead, care professionals must use their clinical judgment to prioritize them and develop a tailored, person-centered care plan if warranted. CAPs can guide both intervention and referral decisions. True/false? The correct answer is true. Based on the Inter-RAI LTCF training materials, collaborative action plans, CAPs, are designed to guide comprehensive care planning by providing suggested clinical reasoning steps and intervention options. Furthermore, they explicitly enable and help care professionals make appropriate referrals, for example, referring a resident to physiotherapy or occupational therapy if they trigger the activities of daily living CAP. Which CAP focuses on residents who resist care or act aggressively toward others? A. Behavior CAP. B. Social relationship CAP. C. Falls CAP. D. Pain CAP. The correct answer is A. Behavior CAP. Based on the Inter-RAI LTCF training materials, the behavior CAP focuses on daily occurrences of disruptive behaviors, which explicitly include resisting care, such as refusing medication, ADL assistance, or eating, and acting aggressively, which encompasses both verbal abuse, threats, screaming, cursing, and physical abuse, hitting, scratching, pushing. The goal of the social relationship CAP is to enhance interpersonal connections. True/false? The correct answer is true. The overall goals of care for the social relationship CAP explicitly include encouraging social engagement, such as interactions with caregivers, and resolving interpersonal conflicts with family or social networks, which aligns with enhancing interpersonal connections.